guys, it's Dr. Nelly here. We're going to brushing up on mouth breathing. What's this whole talk about mouth breathing? We're going to get to meet my friends here. Kelly Dorfman.
It's good to be here, Dr. Nelly. Thank you for having me. I'm a nutritionist. I am licensed in the state of Virginia, and I am also an author of the book, Cure Your Child with Food, which is about the surprising way that many childhood ailments can be dealt with using nutrition.
I'm Kylie Cans. I'm a cranely trained osteopathic pediatrician from the Philadelphia area, and I'm very happy to be here today.
So ladies, I got into this space. So I've been practicing dentistry for 15 years now. And I got into this space because one of my patients, 6 years old, came in to see me, and her mom was so concerned. She said that Stacy had been throwing up in her mouth, and we know that as acid reflux. So I told mom, hey, listen, let's get a CT scan and let's take a look at her airway. And to my surprise, Stacy's airway was so closed. You looked at her airway and her tonsils were touching. Wow. And Mama said her pediatrician told her she would grow out of it. So, Dr. Kylie, please talk to us about inflammation and mouth breathing and how that plays a role.
Yes, oftentimes we'll see patients coming into my office. Parents are complaining these children are often restless sleepers, so they'll be up frequently at night, rolling around in the bed, and they seem extremely fatigued when they're during the day. Also, a lot of these children will see nasal congestion as part of their daily life. They've either been diagnosed with some sort of environmental allergy, or they have physical features with chronic congestion, dark circles under their eyes, and part of what they're coming in for us is to figure out why this is happening. And from their observations, they are saying the children are either mouth breathing throughout the day or even especially at night, mouth breathing and snoring oftentimes as well.
Wow, wow. And so how does this play a role in nutrition?
Well, Dr. Kylie mentioned allergies, but there can also be reactions that are non-allergic reactions. Allergies are now narrowly defined as histamine reactions. So if you're not having a hive or your throat's not closing within a few hours of being exposed to something, it's no longer considered an allergy, but possibly a food sensitivity or a non-allergic reaction. And in particular, dairy foods tend to do this to people. So they don't get a hive from them, but they can have trouble breathing because their body produces a mucus response to the food. And then they get clogged up, and that can also then affect their eating, because try to swallow something with your nose closed. It's pretty tough to do.
I would imagine. And you know, this is actually what I see in my patients too. When they're mouth breathers, they develop dryness in their mouth. And from there, they end up getting a lot of decay, tooth decay. And then from the dryness, they get a lot of gum inflammation. So their gums are bleeding. And also, because their jaws are actually not developing properly, their teeth actually start colliding and their teeth start breaking, and then more decay. So it's sort of like an endless cycle there. So mouth breathing should be taken very seriously, as we see here, as it covers different areas of practice.
Absolutely.
So what are some things that parents should do, especially in evaluating our kids and making sure that this gets treated?
Oftentimes I will recommend, after doing an oral exam in my office, looking for signs of decay as part of that, and structure of the mouth and the tongue. I oftentimes will send them for a dental visit to get further evaluation in the care of these children.
That's awesome. That's great.
Yes, and assuming there's not an obstruction of some sort or some kind of physical thing that needs to be looked at, then you can also look at the food situation to see, or the environmental allergy situation, to see if there's something that could be done to reduce the inflammation and reduce the reaction.
That's great. That's great. And when I evaluate my children, it's very important for me to take a CT scan. So I would like to see their nasal anatomy. I'd like to see the back of their throat. And from there, I can assess to see if they need to be referred to other specialists, like ENT specialists sometimes. So I think all of what we're doing kind of mesh well, and I think it takes a whole team to treat mouth breathing. Would you agree?
Takes a village.
Absolutely.
Oh, well, that's great. That's great. So what are some symptoms if left untreated? I mean, is this something that they can outgrow? I mean, we see with Stacy's pediatrician said she would outgrow it. What are some other things that we should consider?
Well, often what I see is chronic ear infections because all the tubes in the back of your, as you know as a dentist, are connected. So when those get all clogged up, with mucus in particular, that's a happy breeding ground for bacteria and viruses. So these are kids that often get frequent illnesses. So they get pneumonia, they get ear infections, they get bronchitis and all those kinds of illnesses. Sometimes there are developmental problems that can happen with speech and language. They can be diagnosed with low muscle tone sometimes as a problem, and that can, if you don't have good tone in your mouth and you try to talk, your words can be sort of muddled together. So there are a lot of other complications. So this could be a symptom of something else that needs to be looked at.
Oftentimes I will see children, older children, who are now coming in who have had these problems for years, and they're coming in with symptoms of ADHD, inattention issues, problems at school. With that, if they're not getting adequate sleep, they're not breathing appropriately, they're not getting structural changes that are happening, and they're not getting restorative sleep. So we oftentimes see those things as part of this whole process that is not resolving as part of the intervention that really should have been done years prior.
So ladies, thank you so much for your time. So where do we begin? Where do parents start?
Well, I think you want to make sure there's not a physical problem that needs to be resolved. So if your pediatrician has passed it off and said nothing to see here, then a dentist would be a good place to start to make sure there's not any decay, as you mentioned, is something that can happen from a lot of mouth breathing or other obstructions that would need to be taken care of. And then, of course, there's the nutritionist and the osteopath that would look at the biochemical basis of that, if necessary. Would you agree with that?
Yes, I wholeheartedly agree.
I certainly agree with that. We can take an x-ray and see what the airway looks like. And of course, we're going to detect decay and see some other things. Ladies, thank you so much for joining me. I guess I should close my mouth. So guys, we've just brushed up on mouth breathing. And till next time, we're going to be talking to the cardiologist and an airway dentist at the next segment.